This is Reidsville Chamber of Commerce News and Views, a business resource show with a focus on enhancing the business environment through advocacy, mentoring, and education in an effort to promote economic growth. The Reidsville Chamber of Commerce is a membership organization in North Carolina, working on behalf of its members for the betterment of the community. With Chamber of Commerce News and Views you can use, here's Chamber President Diane Sawyer.
Good morning.
Good morning, Diane.
Thank you for joining us. I know this is interesting for me. This is I think our fifth show here on the Reidsville Chamber News and Views show. And as the times are changing, I guess it's been a little bit interesting learning how to do the technology piece and have all the information we need, but I think that you and I are the perfect people to do this. So I'm very excited to have you. Jay, you have done a wonderful job, I believe, in leading Reidsville over many, many, many years, and I'm always very appreciative of how you handle things, and I'm always very proud. I told somebody the other day I'm very proud to be a part of Team Reidsville, and yet again, Reidsville has shown that you're not afraid to make tough decisions when it's in the best interest of our citizens. And I just appreciate that. So thank you for coming on the show this morning to talk about the latest news and how the City of Reidsville is doing just that. So welcome to the show, and we can just jump right in and tell us what's going on.
Sure. Thank you, Diane. Thank you for those kind words. One thing that people may not realize is 19 years ago, I was involved with figuring out why a virulent virus was being spread around Great Britain as part of a USDA team. And so dealing with virulent viruses is kind of in the background that I brought to the table as mayor that a lot of people don't realize. And so that is one of the driving reasons why council has decided, with the number of people that are presently infected in Rockingham County, and now we have 2 deaths, that we needed to do something more so that people were clearly understanding what the governor was trying to achieve in regards to 6-foot spacing, but also for our businesses to have good, clear guidelines to say what does a good business look like that is trying to maintain the social distance while at the same time being able to continue to be in business. So, City Council on Friday enacted a set of guiding ordinances that started Monday night at 7 o'clock. And I can walk right through them pretty quickly, and also say that if I go through too quickly, feel free to go to the city website, where it basically is a 5-page order, but really there's only 3 pages that really one needs to read, and it's straightforward language. It was written so that I could understand it and other members of council. And if we can, I know anybody in this community can.
Absolutely. Well, I just want to say, too, I think that the point being that this is for everybody's protection. And also, I love the wording. Essential businesses are strongly recommended to continue to stay open and do business. And I felt that was very indicative of what you wanted to occur, that this was more about, we want you to stay open, but here are some ways that we can be safe, you can be safe, your employees can be safe, and the community can be safe.
Exactly right.
So let's jump in, go right through it.
Yeah, first point I want to make is all these guidelines need to be implemented for businesses that are 10,000 square feet or more. Those that are less than 10,000 square feet, it's a guide for them to continue to consider doing. But one thing that needs to be done is they still need to figure out, according to the formula we'll hit shortly, how many people should be in their business at one time. For those that are less than 10,000 square feet, it is strictly a guideline. But that guideline we want citizens to look at, and so they can make a decision upon entry or thinking of going into a business. Is this a place where I want to be? Especially if I am a member of the vulnerable population, which is anybody that's 65 or older, anybody that has a heart condition, a breathing condition, a kidney condition, or a diabetic, which is a lot of people in our community. So If we walk right through these, you should be able to recognize, and a business should be able to project that they really want to take care of their patrons and their employees by putting the sanitizing products readily available. So when somebody walks in the door, you should be able to have those right there. You should also have them for your employees to easily get as well. The businesses that are larger than 10,000, we strongly recommend and it is required to have separate hours for the vulnerable population. Some businesses are already doing that. We recommend that they be in the very first hour of the business open because most businesses are closed at night. They can reduce the viral load by not having people in their business so that when they open in the morning, the virus load is much lower, so the vulnerable population will be exposed less. The sign, 8.5 by 11-inch sign, that's just a sheet of paper with a 6-inch number or numbers on it. Very simple, nothing magical there. But any business that, based on their square footage, has 50 or more people allowed to be in at one time, they have to do an active count as people come in and others leave. And those will be businesses that are usually about 20,000 square feet or larger. The reason for this is you start getting 50 plus people in a space and the viral load goes up and people can be much more easily infected. Again, it's not hard to do. Walmart, Food Lion is already doing this. And I'd say most of the others that are 20,000 square feet or more are already implementing it. Okay.
I was just going to say, and we'll jump in. I've had a lot of questions about the signage, and as you said, it was pretty clear. And I think I've been able to guide people through that. We've had some smaller, like industry or contractor people who still have showrooms or spaces where people are coming in, and I think that's kind of the popular thing right now is for people to be working on their homes and doing other things. So. Again, there have been a lot of questions about, is there a sign I download somewhere, or where can I get said signage? And so I think you did a really great job of explaining that because there have been some questions about it.
Basically, it's an 8.5 by 11 sheet of paper, and you take a magic marker. It's a 6-inch. You take a foot rule beside it to make sure it's 6 inches high, and you just write the number on it. And you should post it by the door or entryway to your business. This is nothing special. There's no, the form is exactly as it says there. 8.5 and 11 sheet of paper, most common size piece of paper. And use a magic marker, nice thick magic marker, 8 inches tall. Or 6 inches tall, sorry.
Yes. So I think that you guys have done a really great job of, explaining that. And we appreciate that because it's made it easier for us to share with our businesses and just reread it back to them. So thank you for that. And I think that there wasn't as much confusion over what the city did as there was with the governor, because I had lots of phone calls, but it wasn't anything like with when the governor imposed the shutdown of the businesses. So thank you for making it easy for people to read and understand.
Well, the way we look at it is the governor's the one who decided what the essential businesses are. We're not arguing with that. What we're saying is if you are designated as an essential business, please do these things. And if 10,000 square foot or larger, for a frame of references, the Dollar General and the dollar stores here in Reidsville are about 10,000 square feet. So if any business is that size or larger, these are required. Any size that size or smaller, it's strongly recommended. And the way we enforce it for the smaller businesses is that those people who want to go to a business that's truly looking out for social distancing, please use those businesses. Those businesses who are small and say, we don't have to do that, they're allowed to do that. We as citizens just don't have to patronize them. It's kind of like personal responsibility. Now, 20,000 per square foot building, that is comparable to like Saunders Hardware, Ace Hardware. That's about 22,000 square feet. So if you get a building that size or larger and more than 50 people are allowed to be in at a time, that's where you're going to have active counting as people come in and out. And here's the equation. Basically, the square footage of a building, we divide it by 4 to take account for any storage of their material, any shelving where people can't walk anyway. Divided by 4, the 113.04 is basically the surface or the area within a circle that's a 6-foot radius. It's pretty straightforward. Some of the smaller businesses will say, oh, I can only have one person there. Well, that's correct. Just post that one beside your door. And then if somebody wants to go in there and they're vulnerable, they may want to rethink going in there. They may want to have somebody else go in. But there's not going to be any penalty for a small business that is allowed to have one person in there and they got one person behind the counter and they say, how can somebody else come in? Anybody can come in that small business. It's just that you now are notifying a person of the vulnerable population. You might want to be careful here. You might want to wear a mask. You might want to have the other person on the counter side have a mask too. Or Sherwin-Williams, if you go there, you cannot come in. There's a table outside that has the different color sticks. You basically call them and the directions are right there. So movement control, there are a number of inventive ways that these small businesses can do to keep the social distancing, which helps keep their employees healthy so they keep showing up for work, and also their patrons healthy so they keep coming back to buy their products.
And there have been, even since you guys did this, there have been a couple businesses who have shut down because they've said, you know what, based on these guidelines, we just can't be safe. We can't keep our employees safe, and we want to protect our employees. So, and that's happened this week too. And I think that even when you look at the formula, 23 people in the Dollar General, and that's still a lot of people in the Dollar General. And that
it is.
So I think that this is a good formula, and I don't think that it hinders the businesses in any way. I mean, I think that it's smart, and I think that I don't think that people understand the impact that this is going to continue to have if we can't follow these guidelines. So I think making the businesses do this is going to help the community have to follow the rules, if that makes sense.
It does. And I want to emphasize that this is just for the Reidsville area. We would love for businesses throughout the county to do this, but this was passed knowing full well that we probably are going to lead the way. But I would say to anybody that has a concern, either they are vulnerable or they are connected to somebody who's vulnerable and don't want to bring back the infection, consider doing their business in Reidsville, because you will be able to identify the businesses where you need to get your items that you need to buy, but it'll be in as safe an environment as possible under these current conditions.
Agreed. It's a great point. I know that this is a major point for you. Let's talk about the mass gatherings.
Yes, this is a really big point for me. The governor said that mass gatherings are 10 or more than 10 people, therefore don't do it. However, a huge loophole that you could drive a Buick through was that funerals could have 50 people, up to 50 people attend. Well, that just isn't going to work, and it hasn't. It's been shown not to work. We have a similar situation, small city in southwest Georgia, Albany, which had 2 funerals under guidances like that. And of those 2 funerals since then, 1,500 people have been infected. They were positive. 54 have already died, and another 160 are in the hospital. We do not want that to happen here in Reidsville. And all the funeral directors in Rockingham County are agreeable for doing this, except one in the City of Eden. And so I would closely question any of your funeral directors about this, because this is a real deal that if you get too many people congregating, you will have the virus being passed among you. And I can say that the vast majority of funeral directors very much, in fact, they actually passed this before the governor actually passed his order, because they were concerned right out of the get-go, because many of the people in the mortuary business understand about infections and literally about people dying and how you avoid it. And so I was a little bit disappointed that there still is one funeral business here in the county that doesn't want to buy into this. But again, we live in the United States and everybody can make those choices themselves.
I agree, and I understand the need for this. And I think that I was very proud to find out that they had already decided that on their own. Again, I think that Reidsville also leads the way in a lot of things, and I'm very happy to report that people are working together and having conversations about these things. I had some conversations with some folks about it and what their plans were as well. And so very happy to know that before it even became a thing for Reidsville, it was already happening this way. So.
And the funeral directors really led that effort. They're the ones who called me and said, Jay, something has to be done here. So kudos to them.
Absolutely. Well, I know that we have some other slides and some other things to discuss, and some of our information, unfortunately, is already out of date, just due to the fact that we have more things that have happened since these numbers have been updated. So let's talk a little bit about the numbers and how these deaths are at the Cone Health facilities and how that relates to what's really happening.
Okay, yes. Well, now there's 8 confirmed cases with 2 deaths, but please, the only people who are being tested are those that are in the process of being hospitalized. So for every person that's hospitalized, if you look at the data, there's about between 40 and 50 other people who are not hospitalized but are infected and shedding the virus. So you basically could take 6, multiply by 50, and there are probably at least 300 people walking around shedding the virus right now. And in a county of our size, that's a lot. We interact a lot in our county.
Absolutely.
So and it's not just me getting infected, it's me sharing it with somebody else who's more vulnerable becoming infected.
Let's talk about what you just said in relation to the people that are being hospitalized or the ones being tested, because I still think there's a lot of misinformation in the community about why people are or aren't being tested, and in the coming weeks how that could look different.
Sure. First, we have to realize that when you test somebody, it's basically saying if that person comes up positive, what the situation was about 2 weeks ago. That's number one. Number 2 is there appears to be a kink in the chain in the testing process. I've spoken to people at LabCorp, spoken to people at Moses Cone, I've spoken to people in Burlington, I've spoken to our county health department. There appears to be at LabCorp quite a backlog of thousands of samples that are being quick frozen, in which they assume and they expect the test results to be the same if they didn't have to freeze the samples. Let's hope that's true. But there's a backlog. And that backlog is giving us, in my opinion, certain people in the county a false sense of security. We can see the numbers going up around us. We can see the numbers where tests are more freely available going up. The reason why hospital systems are only doing those that are in the process of being hospitalized is there is a shortage of the testing equipment, whether it's the swab to get the sample, whether it's the reagent. There's a number of reasons. It's in short supply, and our hospital systems are conserving all these tests and their PPE to make sure they absolutely have to use it at that specific time. And I applaud them for doing it. But we shouldn't bury our heads in the sand and say, oh, we only have 8 now. Oh, what's that? We've gone from 6 to 8. Ah, that's no big deal. It is.
And it's truly what people are saying. I still think they just don't understand the brevity of the, well, let me back up. I think that the information is there, but I think that a lot of people choose to believe that it won't affect them. It's that whole, idea of, oh, well, it won't happen to me. And it just really, I think, goes to show, again, Reidsville has been leading the way from the word go. And I can tell that in the phone calls that I have received at the chamber. I have received phone calls from all over the county and the borders of the county, people looking for help and looking for guidance. And I would bet that City Hall has gotten some of the same phone calls, because people see that Reidsville is leading the way and that Reidsville has taken it seriously. And I get phone calls about where to find masks and where to go for information and how, the businesses. I mean, I've heard from farms and I've heard from sole proprietors who were out of their homes who, I'd never heard of before. So I think that people want to do the right thing and want to be informed, and they're looking and continuing to look to Reidsville to give them that information. And I think that's a good thing.
We certainly don't have all the answers, but we know what we don't know. And so we do look to the experts for their advice, which, again, expert advice on a virus that nobody's had experience with, you should always err on the side of safety. You shouldn't assume that it's, like some other virus, we're good to go. That is a very bad mistake.
I would agree with that. And I think that's a key point, too, that we don't know. We don't know all the answers, but we can make decisions based on what we do know. And I think that that's important.
Absolutely.
Is there anything else that you'd like to add about the numbers or Cone Health or, how things are moving forward or timelines? I know that there have been a lot of information about people believing that this week and next week will be the peak, and you and I both know from calls that we've been on. I know that the president of Amy Penn will be presenting to City Council next week and giving you some updates. I know that they are partnering with UNC Rockingham to give updates to the county commissioners at their next meeting as well. And so I didn't know if you wanted to add anything to that before we move on to some of the other Team Reidsville stuff.
Yeah, the only thing I'd like to add is, please, everybody, don't discount curbside pickup. We've got contractors at Lowe's that are using the Pro Desk so that they can do curbside pickup or have delivered to the building site. That reduces exposure to their employees. We have curbside pickup at our grocery stores, including Walmart. And if anybody wants to see what good looks like, I can tell you today, all they have to do is go down to the Food Lion on Way Street, and that's exactly what should be expected for any stores that are 10,000 square feet or more. And I know I'm probably doing a disservice for all the other stores that have implemented them, but I do know I've been there, and we've got some pictures, but they actually are a good example. But if you're vulnerable, I would say don't take a look at it unless you go during the vulnerable hours. But better yet, I would suggest that you do curbside pickup for their groceries, so that basically you don't get exposed where you're getting those essential food items.
Can we make one clarification to that? When you say curbside pickup, we're referring to curbside pickup with essential businesses.
Say that again?
We are referring to curbside with essential businesses that are still open. Correct?
Yeah. And well, actually, even if they're not in it's only the businesses that are open. That's correct. And curbside means not necessarily picking up the phone and saying, hey, can you take down my order and I'll pick it up. Most are doing online ordering. So you go online to a grocery store, pick out your items. They will tell you when you should come by to pick it up. And with Food Line, if you do that online, you may find that it might be a food line that you normally don't go to, because it's all based on the items that you want and the time that you want to pick it up. But the same goes for Walmart. They do it. Same goes for contractors. They can contact the Pro Desk and go in the Pro entrance and just pay for what they need to. And if they already have an account, they can do it all that online as well, and then pick up the whole load at one spot and not have to wander around in the building supply area.
I just wanted to make that clarification because I have received lots of, can I do ordering over the phone and do curbside pickup, and I have discouraged businesses who are not supposed to be operating from doing that. And so I just wanted to be clear that we were discussing businesses that are still open and allowed.
You're right. And that's a good point. Yeah. Anything that we have here is for the essential business that are allowed to be open. You're absolutely right.
Perfect. Well, let's talk about the other information. I know that we have the slides from the resources and things that have been put together. So let's talk a little bit about food resources and where people can go in the Reidsville area for the students who need food.
Sure. I mean, food insecurity is a real thing in our Reidsville community, and we need to be able to provide decent meals, because part of the way that a person resists a significant infection is to be well nourished. And so you can see how through the Rockingham County School District and Mall Street Elementary, where you can get grab and go breakfast and lunch. If you need food, there's a hotline that you can contact them, the YMCA. You can request meals. Next slide.
Yes, absolutely.
And then, of course, I got to do a shout out to Cafe 99. Dave Garrels jumped to it right out of the gate, saying we will provide free meals for children. Sheets has followed suit, so has Mom's Kitchen. But Cafe 99, immediately when this became apparent it was going to be quite a large issue in our community, they jumped to it and have set a model for what, to me, a very generous donation on their part for our community, ongoing donation.
Absolutely. Dave's always in tune with that sort of thing too, so he's usually very good to fill the need. Especially, he loves children, so when there's a need for children, he's always there. So we appreciate him as well. The resources. I have been also, when I see something like this, I have been texting it, even if it's not something I need, to see how the resources are operating and how they work. And they work very well, that I have seen so far, for the parents to do. So the texting the food NC to the 877-877, it's an immediate response, and they ask you for your address, and it gives you exactly the information that we just did. So I thought that was really cool. Do you want to talk about the No Kid Hungry?
Sure. I mean, that's a good way to go online, just to see where you can get food, be fed for your family. There are numerous ways that we can identify, or one can identify. Now, of course, if you're not online because you can't afford to do that, you can go call the library, and they certainly can look it up for you to help you. Or go to the library, being sure that you keep your social distance. But I would start with the school district and work through them first. And then the outreach center. Next one, the distribution is today.
Yes.
These are for families in which you have enough food that is dispensed to you for a week, and you have to prepare the food. This is not a food voucher. This is not quick and easy fast food. And so for families, it's a really nice, generous.
Yes, especially because right now, even though the grocery stores are open, it's sometimes difficult to get food and to get essentials.
Correct. That's exactly right. And then, of course, Salvation Army they have always been doing good works in our community, and they have really stepped up to the plate.
Absolutely. Well, those are the information that we had about the resources. And I know that there are a lot of other resources. I know that the Rocket and Reidsville website has a COVID-19 resource link. The Reidsville Chamber also has a COVID-19 tab with updates basically daily as we get information from the businesses about funding options and other resources regarding things. One of the latest things that I just got yesterday was the Attorney General, Josh Stein, had put out. The latest scam is people trying to get with businesses to tell them that they can get them the PPP or other loans, and scamming people to get information from them or to get them to pay them to help speed the process up, and a scam. So we've been updating the scam alerts and that sort of thing on the website. So there's a lot to process and a lot for people to know, and particularly our businesses, and to continue to help the community be safe. Is there anything you want to add to the points that you made?
Only that we have a city administration that can walk and chew gum at the same time, so all the essential services are still being taken care of by our city. and that we are actively developing the budget for next year, and we're certainly taking into account what we're going through right now. And my final thought is, we're all going to get through this. Hopefully, all of us are still here to talk about it in the months and years to come, but that it's only by all of us doing our little part to be responsible can we keep the infection rate down to a level that hopefully won't impact too many people's lives. But I'm very hopeful. I think that we have the right people in the right spot in our community. That goes for you, Diane, and all the leadership that you're doing, but also throughout the community. And we will get through this. I think that many people are very nervous and worried, anxious for a lot of different reasons, not just for health, but economically as well. But I think that we now have shown a light on the issue, that enough people in our government, federal and state and local, that we can be assured that the best choices are going to be made. And I can only speak for the Reidsville City Council and myself, and it's an ongoing process, and we're trying to do the best that we can. And I appreciate everybody's support and trust that we will do this.
Jay, you guys are doing a great job. You really are. And I can't say enough how proud I am to be a part of Reidsville. And I would echo that all the key people are the right people, and that we have all been able to do a phenomenal job together to make things happen. And I'm very appreciative of the council and the city staff. I talk to Missy probably every single day. We have a lot of great things in the works that are launching in the next couple of weeks. Just trying to support our business community the best that we can, and the general community as well. It's a very tough time in uncharted waters for people with school-age children and for families. And it affects everybody. It affects every single person in our community in some way, shape, or form, or in multiple ways. So I'm just very thankful for the things that are happening, and we appreciate what you're doing.
Yeah, and my final thought is we are flattening the curve. These measures are working, but it's going to be a longer duration. So our order goes to the end of April, just like the governor's. I will predict, and this is just me, that we're going to extend it for at least 1 month, maybe even 2 beyond that. We will only let the virus gets a vote in that conversation, and the way it's behaving indicates with the flattening of the curve, we're going to have to be vigilant for a little bit longer. But that's a good thing, because if we had a surge that overwhelmed our hospitals, so it rolled through short amount of time, we'd have higher deaths, more hospitalizations, and a worse impact on the health of our entire community. So
thank you for explaining that. There's a new article by a doctor going viral about how if we'd just let all the people out of the house, it would just go away, because it would just move through quicker, and, herd immunity and all that.
Yeah, herd immunity.
It is, I think it's very hard for people who don't have any sort of background in epidemiology or disease process, or anything that would allow them to understand why things are happening the way that they are. It makes it seem almost ludicrous to some of those people about why we do things the way we do. So I think you've done a really great job today of explaining all the things that are happening and why they're happening. And again, we're just thankful to have you as the mayor, and that's kudos to you as a person, because your ability. Very much, I'm in very much the same boat. My background and what I do and what I've done and my education has helped me make some decisions about things for the chamber that I think are important. So being able to mix health and business has been a good thing, I think, for both you and I.
Great. Thank you.
Thanks for being on.
Oh, yes.
Anytime that we can have someone come on and represent the wonderful things that are happening at the City of Reidsville, I appreciate it. So thanks for being on the show today, and hopefully we will see each other in person soon.
Right. Our council meeting we are going to have Tuesday. There will be 4 council members present, 3 calling in, and we're having everybody spread around the room to keep social distancing. We have a much reduced number of people that can be in the lobby or actually be in the actual chambers. Again, based on social distancing.
Absolutely. Y'all are doing a great job.
Thank you.
Thank
You
you
too.
for what you do. I appreciate it. All
Thank
right,
you
Jay,
for all the chamber does.
You're welcome. We are working hard to get that information out. So have a great day. Thanks for being on and for explaining everything so well.
Well, thank you.
See you soon.
Yes.
Right.
Bye.
Bye.